Hi, I'm Dr. Richard Jermyn, Dean of the Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, our podcast series dedicated to highlighting the thought leaders who are advancing the mission of our medical school. Our mission is to foster innovation, elevate excellence in education, and advance transformative healthcare practices. Today, I'm personally thrilled to have Dr. Kenneth Stagliano, the Director of Grant Acquisitions. In this role, he supports clinical faculty in obtaining funding for medical student training, programs that help communities most in need, and to support the clinical research initiatives. He comes to us with years of grant and research experience. Dr. Stagliano is a wonderful collaborative leader and has committed his career to serving the marginalized communities. We are very lucky to have him as part of our mission here at Rowan-Virtua School of Osteopathic Medicine. Dr. Stagliano, welcome. And I just want to tell everybody here listening, I am a mere neuron in the brain of Dr. Stagliano. And I just want to start out. You were an organic chemistry professor, right?
Right.
I don't know, a lot of people just cringed for a minute, just so you know, organic chemistry. How'd you become a grant writer?
Well, definitely, if you're in organic chemistry and you're a professor, you have to run a research lab. So I know that, if you want to have graduate students and undergraduates, you can have all these research ideas, but you really have to get funding to support them. So that's where I got introduced to the grant writing business. But after working in academia, I transitioned into the nonprofit treatment sector, and I learned the grant writing business from a person who was almost a professor of English, and he taught me all the intricacies of writing, and I became really interested because we were helping people at the treatment center.
And let me stay with that for a minute, because your interest, we share the same interest, which, by the way, is the mission of our school, right? To really service underserved communities and finding innovative ways to bring medicine to communities that don't always trust healthcare providers by far. And I think, and you and I have had many conversations, and on full disclosure, we do a lot of work together in substance use disorder. But I'm just gonna ask you, so why this huge interest? Why is your heart in this mission that we're serving right now?
I think, it's funny. I used to live in Chicago, and I used to live in this building called River City. It was right on the river in Chicago, but right down the street was the Pacific Garden Mission, and that was a homeless shelter, people experiencing homelessness. And I, would see them all over the neighborhood, where in the west, it was called Printers Row where I lived at, and I really had a little bit of compassion. But when I went to Haymarket Center, it was just, Haymarket Center really was developed by a Monsignor. It's in Skid Row. It used to be Skid Row in the West Loop in Chicago. And the people that go there are suffering, really predominantly homeless. And they had a 24-hour walk-in detox that, you didn't need an appointment, you just go there. And so people that were really suffering, the worst people that were really suffering, they could get admittance and detox with dignity. And in the old days, they used to have a rubber man that would had a rubber suit, and in the showers, and people that were just living on the streets, they would gently, hose them down, give them clothes, and they could detox with dignity. And then that's where I really kind of became interested in that. When you see that kind of suffering, and some of the things I'm really interested in are emotional states that are extremely, for example, all the naloxone work, the grants on naloxone, people that overdose, when they're given naloxone by EMTs, they're in a withdrawal crisis. I mean, people don't really realize how they're feeling, and that's why we have these mobile units that can kind of get up front and try to help them get into treatment, right after revival.
Let's take one step back, just so our audience knows. So what does your department do?
Well, basically, it's myself and Amy Palin, who's a wonderful grant writer. I'm so grateful that she's there, and Alex Abbott and Donato Tassoni. And what we do is we really just help the faculty move their ideas to like a grant proposal and hopefully for submission. And I got to tell you, Frances Harvey is an important part of our department as well. She's in a different sector, but she helps us so much with the submissions. So basically what we do is we're available for the faculty if they want to submit a grant. We'll help them from conceiving the idea all the way to the submission process.
That's a heavy lift.
As more and more faculty become interested in grants, it can be hard. So what we do is our whole department works off a grants calendar. We just have a calendar when everything is due, and they're hard deadlines, like you can't miss the deadline or you can't submit it.
I know all the grants are like your children, right? So I know that. But do you have a favorite grant?
I like them all, actually. I like the interconnection with all the different grants to see that, like the osteopathic peer recovery coaching model that started with the SAMHSA grant, and that translated to the need to integrate health into recovery support. So the HRSA grant on CHW training and integrating that with the CPRS program, that dual training program, and then to see that transition to this FHIR-based electronic recovery support system. So that interrelationship is so cool, And I like all the naloxone stuff, but I do like the loneliness stuff because I think that's an important part of, people, the health of people. And one of the grants we just wrote for Dr. Maitland was kind of cool. It's a, like medical residents, when they interact with people with substance use disorder, especially in an ER situation, they might not really understand what they're going through. And a lot of the people are back in and out of the detox in the emergency room. And well, one of the things that we tried to do in one of these grants was to catalyze the advancement of loneliness, education, management, and research in graduate medical education. It's called Calmer GME. And what it's about is to retrain people about substance use disorders, to tell them that one of the real issues is that people who use substances like excessively may have been on a binge for like 3 months, never seen anybody. Now they go to the ER, they're in loneliness crisis. You might be the first social contact after like 3 months, And so and because many medical residents have experienced loneliness, because studying for medicine, as you know, can be very lonely. Like you got to
Absolutely.
And so they can experience that and have this common bond. And that could start the healing of the environment, the graduate medical education environment. I like that very much. I don't know what the funding agencies, if they would like it, but I like that.
I think people are starting to see why, I'm a mere neuron in your brain, because one idea spreads into others, and working with our faculty, I assume has been really, really positive.
Yes, they're very, very nice, the faculty.
And our students. And I kind of want to go back a little bit. Why'd you come here to Rowan-Virtua SOM?
Well, I have some personal reasons, but I could tell you why I stayed at Rowan SOM, because
Okay.
I actually live right down the street, so it's a beautiful, I wanted to move from Chicago back to New Jersey. I grew up in New Jersey, but I just love the family atmosphere of Rowan SOM. I mean, people are so nice, and I know that the doctors have such hard clinical hours. Like I can see that they don't sleep too much, basically. So I kind of am have compassion for that, and I really want to help them.
I think getting back to mission. This is why we even do these podcasts, so people see. One of the things I had to learn pretty early on in my career is no money, no mission, right? And having these grants have allowed us to do amazing work. And getting out in the community and actually not only having a mission, but growing our mission, right? And so I want to thank you for that. I think that you have really allowed us to really dream to a point, and I never thought we would have now a fleet of vans, and we're talking about building trucks, and to what you said earlier about our work in the unstable housing, our homeless communities. Very shortly, we'll have a truck with a shower to give dignity back to people that are struggling. And I learned in the work that we have done in substance use and even doing vaccinations in the underserved communities that food and showers are pretty important, and socks, right? Socks are pretty important, right? We'll take donations for socks for our unstable housing because it's a huge draw. So we learned a lot of that together, and again, thank you for that. What do you see for the future of your department?
I guess it's for the future of Rowan SOM. I did want to comment on what you're saying. Like, a lot of the grants, they get funded because of the infrastructure that has been built over so many decades. If we didn't have those like collaborations and letters that, those relationships you built over the years, we wouldn't be able to really have a good product, the grant that you submit. So that's really important, the infrastructure that's been built. So many people have contributed to all of that. I really think some of the things that I'm interested in is like, I think that people should take a look at is just the chemical intake in the community. Like, for example, with the legalization of cannabis, how that affects social dynamics in the community, and people might not really realize, it's actually with cannabis, as we live in the West, all of our pharmaceuticals are like single chemical entities. Whereas cannabis is one of those entities that have multiple components. Yep. And we don't know how those components basically affect people and families. And so there should be like a bioevolution project where you begin to see, begin to test for cannabinoids, as part of medical, examinations, if patients want it, and to see if that's affecting some of their health. I think that we should kind of be aware of that might be a problem. Yeah.
Yeah, I'm with you. I'm ready to start taking a look at that. And we have quite a bit of faculty, even at a basic science level, as you know, that do research in cannabis, and so very interested in taking a look at this from all these varying directions.
Another thing I think too, a lot of the substance use, some of the NIH funding, for example, on programs like, for example, naloxone training, and I think one of the real gaps is the continuum of community. Like, people that tend to really recover from like opioid addictions, a lot of them have no employment when they enter treatment. They're unstably housed, and I think there needs to be a program where we study, like, give them the first 2 months rent, give them Uber rides to like recovery support meetings, food, their employment. And really test to see whether they have a social connection in the community, in the recovery community. And I think that really is what makes people recover, that they're not alone. Like, there's probably really thousands of people in the community that are suffering from this, and the people that tend to recover bring people into a network where they're healthy, and even though they've had a past. There's an old saying, people with the worst past can have the greatest future, And so, like, if you have that kind of mentality, that experience, they can begin to help other people.
So our grant writer right here, I have to say, runs our division, and so mission-based. And so Dr. Stagliano, I want to thank you. You have about 1,000 medical students, nursing students, and probably PA students who are watching this right now, who are probably going to email you about getting more involved in some of the research that we're doing. This very much moves our mission forward. So I very much want to thank you, and I want to thank you for coming here and telling us what you do, and the work that you do, and some ideas on where we're going in the future. And I think almost everyone listening to you today can understand the loneliness. I think that will resonate with so much of us. Our students, and a constant reminder to reach out, right? If you're at that, you're feeling that way, you have a community around you. So we're here for all of you, and I can't wait to see what you're going to do next. So
Absolutely.
So once again, thank you for being
welcome.
here, Dr. Stagliano, and I want to thank our viewers once again for meeting amazing people that are here day to day, that are doing all this work in the background, that are helping move our mission forward. So thank you again for tuning in. Please tune in next month, and I will see you shortly. Bye, everyone.